Good afternoon, my name is Hugh Wong. I'm the head of the Accident and Emergency Department at the Kingston Public Hospital. I've been associated with the Jaja Foundation for the last 15 years or longer, and it is my pleasure to be once again with them at their annual ultrasound conference. This year is a little bit different because we have collaborated with the American Friends of Jamaica to provide machines, handheld ultrasound machines, to the fetal maternal units across the island. So this year's meeting is a little bit bigger with more attendees. We have about 6 to 9 models who will be scanning for the benefit of our students. All right, so the use of ultrasound, as we all know by now, is going to replace a number of things. It may replace our stethoscope. In some instances, has already replaced X-ray, and with the modality of the handheld butterfly IQ instrument, it means that we can scan a patient almost anywhere at any time without the need for bulky machines, and we can also share the information gained from these ultrasounds in real time with others all over the globe. With this collaboration, we can make earlier diagnoses, we can intervene earlier with patients who have conditions that require immediate intervention, and generally make the life of the clinician easier and make the patient safer. Well, Jamaica has always been a trailblazer, and we're really pleased that we're able to access this technology that other countries may not have or have access to just yet. We are in the footprints, in the shadows of the United States, and I think, you know, we getting this new technology is only fair and will benefit our patients. Well, you know, let's go back a little bit of history. And Trevor said it many times. Back in around 2007, I think, or 2006, we had Dr. Dixon visiting my hospital. He came to the E&E department, we spoke a bit, and he made some promises that, you know, sometimes some person would have come before and made promises. He gave me his card, and I recognized that he was a trained ultrasound lecturer, teacher, and I found that we could use his services. So initially it was a selfish motive, honestly. Eventually I found out that Trevor is the real deal. He's a nice guy, he's a Jamaican. He is 100% for health services in Jamaica. He has stretched himself, he has used his own resources. He has gone out and he has provided for Kingston Public Hospital and the wider Jamaica in many ways over the years. He's the real deal. And because of his genuineness, we found that we work very well together. So the Jaja Foundation and the KPH are basically symbiotic. I've been to his hospital, he has come to KPH many times, he has brought his team, including yourself, and you have seen what we do. We share similar hospitals, as you say. Jacoby treats all manner of injuries and very ill patients, probably of a lower socioeconomic level, just like KPH. And so demographically, we share patients. So the relationship is just great, and you know, these are some similarities that make us kind of gel and work together. Okay, so I can make a rough guess. We've had a relationship in terms of ultrasound training from 2008. That's making 15 years. I send an average of 3 or 4 doctors. So that's almost 60 doctors who have trained from my department alone. Some of these doctors have left, have gone to other hospitals or gone to private practice and are still using these skills. Tomorrow we have a presentation that will highlight some of the guys who have trained and their successes and where they have gone to now. So KPH has benefited, my department in particular has benefited a great lot from the Jaja Foundation's focus on ultrasound care and ultrasound training.
All right, well, thank you very much for your commitment.
Thank you, Gary.
Thank you.